explant surgery is more popular than ever.
Yep.
In my mind though, if a patient spent 10 years with quite large implants and then they're having them explanted, how do they just get used to having smaller breasts again?
I do lectures around the country and the world on this specific topic. So explant surgery, I think, is a very specific way to manage this. If somebody is interested in having their implants out, which I think is often a really nice idea for them, the first thing I always do is remove the volume ahead of the real surgery. And if they have saline implants, it's just as simple as sticking a little IV in the implant and draining the saline. If they have a silicone implant, I can just do it under local anesthesia, just a small incision under the breast, very little area, and just pull the implant out, wash out the pocket, and close things up. That gives the breast a chance to then shrink and contract as much as it's going to. I use the analogy of a patient has a baby. When the baby comes out, the stomach is still stretched, and then it takes many months for things to go back towards normal. Breasts are the same thing, but it happens at a much faster rate. Usually within about 4 to 6 weeks, you'll get major shrinkage. That gives the patient a chance to see what they feel like without implants for the first time, and it also gives them a chance to change their mind. So if they're happy with it, then you can just do repositioning the muscle, a lift, and maybe fat grafting. And if they really miss having the implants, it gives you an opportunity to then maybe put a new implant in, but a smaller implant. So that maneuver of removing volume ahead of time, I think, is critical in terms of getting the best possible result.